I'm going to show you how to practice your COVID-19 assessments as an ALS paramedic for free in virtual reality in 5 minutes or less. I don't actually know if I can treat this patient in 5 minutes, but we're going to try it anyways. First, you need a MetaQuest headset. Check. Next, you need VR Patients. Go to vrpatients.com. Yep, that's me. Next, click on Watch and Learn. Then scroll down until you see this right here. New experience with your personal MetaQuest headset for free. This is through AppLab. Click here. This will allow you to download the app through AppLab and it'll add it to your Oculus, MetaQuest, or Facebook account. Now let me show you how to do this all on your headset. All right, I just booted up my headset and here I am in the home screen. I'm going to look down at my little menu here in front of me and go to the store, which is the orange icon with the little shopping bag. Click on that. It's going to bring up the Oculus Store. I'm going to click search and I'm going to type in the words VR Patients. VRP, and it looks like I have already typed this before. Click, and it's going to do a quick search. There it is. Mine says purchased because I've already downloaded it. It is free. When you click on it, view details is where you want to click next. And immediately I'm transported to a very similar screen that we saw before, available through AppLab. Now there is a warning here that says, hey, Oculus didn't make this. And we're going to say, yeah, we know Oculus didn't make this. VR Patients is giving us this for free. Okay. And right here it says start. If you have not already downloaded this for free through AppLab, this will say download or get or something like that. So you click on the blue button, let it download, and then begin. But it's time for us to treat a COVID patient. Maybe he will look like this gentleman here, so let's jump in. Okay, you'll see this screen here. I am currently logged in. Now there will be a login screen. It auto-logged me in. If it doesn't auto-log you in because it's your first time, it's going to say username and password or get access or a button like that. So you want to click on that and sign up so you can get access. And there will be 3 free cases here, including the COVID case, which we are going to do right now. We want the VES respiratory distress COVID-19 ALS. Click. Load case. It's going to give us a dispatch. The caller thinks the neighbor may have COVID-19 and hasn't heard from them in 2 days. Okay, I've been sitting comfortably, but we're in virtual reality and that's not the way to treat a patient in real life. So let's get out of this chair and start this case. All right, once your case loads, press start. Okay, so here we are. I'm in a residence or a hotel room. I have a patient, and I'm ready to start practicing my assessments in virtual reality. I can teleport up to him and get started with my assessment. Immediately, we're going to put on our PPE, go back to assessment, questions. Sir, how old are you?
84.
Now, as you can see, I have a lot of assessment questions here, and these follow NREMT guidelines so we can get our sample and our OPQRST going. We're going to go back. I want to do a physical assessment on this patient. Let's see here. Head. I click on head, and I see that their head is diaphoretic across the bottom. Excellent, thank you. Their face is flush and diaphoretic, and I can go through every body system here of this patient and learn about their physical assessment. I'm going to pull out my stethoscope. I need that for this particular patient. They're a respiratory patient. I have a stethoscope here, and I go up and listen. I'm just going to reach around back like you would in real life. And there's something going on in there. You got some junk in your trunk. As a paramedic, that's what I care about. We're going to get you into the hospital. I'm going to throw them on the monitor. Now, in real life, perhaps my EMT threw them on the monitor for me, checked their temperature, and did a glucose for me. So when I arrive at the emergency department, I have everything that they need to assess this patient and know this is not a diabetic problem. The patient did not hit their head. Their blood pressure is okay. But as you can see, this patient has a respiratory problem and an infection going on inside. So let's load and go. I'm going to click on transfer. In the top, I can see that I have a timer on here. I've been doing this for about 4 minutes, so I'm clearly not going to be able to complete treating this patient in this quick 5-minute video that I promised you. We're going to treat them one more time, and give them some oxygen. How about a non-rebreather at 15 liters per minute? Again, follow your local protocols. This is a COVID-19 patient. Sometimes you're not allowed to put them on a non-rebreather because it is an airborne disease. Maybe you want to do a nasal cannula and an N95 over it. Follow your local protocols. But as you can see, I am actually treating and taking care of a patient that I can stand in front of, grab the monitor, see adjustments and changes in their glucose, their temperature, their end tidal, their SBO2. They're tune lead, and that is how you practice your COVID-19 assessments in virtual reality for free. Enjoy, check out App Lab, go to vrpatients.com, and up your game. See you soon. Oh, I failed. Great.